A sudden job loss, a medical diagnosis, or a cross-country move, these transitions exert a crushing weight on mental resilience. Common advice suggests weathering the storm, assuming that if you wait long enough, your routine and your mood will naturally return to normal. But sometimes the initial shock doesn't settle. Instead, the feeling of being overwhelmed begins to intensify, and the ability to handle basic tasks begins to stall. When daily tasks become impossible, it is a sign that the brain's stress response has moved past healthy limits, directly impacting everything from concentration and decision-making to basic sleep-wake cycles. This manifests as persistent emotional withdrawal, anxiety that feels out of proportion to the day's events, and a low mood that refuses to lift despite your best efforts. It is common to mistake this for a lack of willpower, unaware that these specific reactions fit a documented clinical pattern. Daily impairment occurs when the stress disrupts your ability to hold a conversation, finish a shift at work, or maintain a consistent schedule. Clinical researchers identify this escalating state as a specific disorder triggered by the collision of a major life event and a breakdown in internal resilience. Clinicians define this precise phenomenon as adjustment disorder. This timeline identifies the core chronological criterion. Symptoms must develop within a strict 3-month window following the triggering event. It is the most frequent diagnosis in outpatient mental health settings, making up a massive portion of patients seeking professional help for the first time. Because these symptoms often mimic other conditions, an official diagnosis must be made by a licensed clinician. Since this is tied to a specific timeline and a singular event, the path to recovery focuses on immediate stabilization rather than long-term character analysis. Short-term therapy is the primary tool for resolving this specific crisis. Brief cognitive behavioral therapy and problem-solving therapy target the immediate disruption, providing tools to reset the brain's stalled coping mechanisms. The objective is to return you to your previous level of daily functioning as quickly as possible. This is a focused approach designed for an acute problem, prioritizing practical relief over years of psychological exploration. The 90-day window of adjustment disorder creates an urgent need for help, yet traditional clinics often operate on 3 to 6 month wait lists. Between travel times, rigid office hours, and the difficulty of finding a therapist in network, many people abandon treatment before their first appointment. To be effective, treatment must be available the same week the symptoms begin to interfere with life. Navigating this disorder requires a system built for speed and ease of use, ensuring professional support is available the moment it is needed. Coping and healing counseling removes these barriers by centralizing telehealth services for the entire state of Georgia. The practice provides same-week scheduling for residents in all 159 Georgia counties through 100% HIPAA-compliant telehealth. Their team of over 15 licensed therapists includes LCSWs, LPCs, and LMFTs who specialize in treating individuals, couples, families, and teens starting at age 13. They accept Medicaid with no copay and partner with major commercial plans like Aetna, Cigna, and Blue Cross Blue Shield, bringing session costs down to between $10 and $40. You don't have to navigate a major transition alone. If your daily life is stalling, you can reach out for fast, focused support at 404-832-0102 or by visiting chctherapy.com.